Hi, today my name is Kristen and we're going to start off by taking blood pressure on my subject here. Just going to make sure I have consent to do so.
Yes.
Alright, thank you. And before we get started, I'm going to palpate her pulse right over here and note that spot. Might take a second to find it. Alright. Right there, and I'm just going to kind of visually remember that spot because that's the spot we're going to use for our stethoscope. And that spot is going to be where our arrow points down. When we apply this, we want it to be snug but not too tight. We have our dial there and our pump right here. I'm going to put on the stethoscope and find that same spot with the pulse. Alright. I'm going to put that right there for safekeeping. And as noted, this is a resting pulse, so she has been sitting here for 5 minutes, just resting. Making sure this is close so that when we tighten it, it actually inflates. I'm going to start to tighten it, and we want it to go up to 160 to 180. Alright, and then I'm slowly going to loosen it, listening for that first sound. All right. And listening to those sounds and seeing that dial, I got around 122 over 78, which is pretty good because normal is 120 over 80, and we were pretty close to that. So that's how you take resting blood pressure.
3, go.
Hey, I'm Kristen, and we're going to be taking waist to hip ratio measurements here. We're going to start off with the waist measurement. It's usually right around the umbilicus region, but we're going to look straight on for the most narrow point in her physique. And with our tape measure here on the centimeter side, I'm going to ask her to lift her arms and raise it around, making sure it's nice and level throughout. Not pulling too tight, and it looks like we are at 77 right there. And then we're going to do the hip measurement, which coming from the side is looking for the widest point. Same thing on the centimeter side. Making sure everything is nice and level. And it looks like we are at 101. Now we'll say 100 and a half. And those are the waist and hip measurements. Thanks.
Go.
Alright, I'm Kristen, and we're going to be doing skin fold measurements for our participant here, who I have consent from.
Yes.
The 3 measurements for a female are the tricep, the suprailiac, and the thigh. And we're going to go through and do that. We're going to start off with the tricep. The first thing we want to make sure is we do get the true midpoint between the acromion and the elbow joint. So I'm going to have you bend your arm out to the side. I'm going to find that acromion and the elbow joint, and we have 28, so we're going to do 14. And go ahead and relax, holding my finger there. And I'm also going to find that midpoint between sides, which is about there. Alright, with my finger there as a placer, I'm going to make a more permanent indentation, just a little X with the pen. Alright, so now I can lift my finger up. That's where we're going to be measuring from. So I'm going to start off with, sorry, I'm putting that in your face. Not too big a pinch because we don't want to get muscle, but we don't want too small a pinch to get skin. So a good pinch there, and I'm also going to have her flex her arm right there, perfect, to make sure I just don't get any muscle. And hold it for 1, 2, and we get 25. Good. So 25 is our measurement for the tricep. The next one we're going to do is the suprailiac. So I'm going to start by finding her iliac crest and going 1 centimeter above that. So finding her iliac crest, I'm going to go in here and find that bony part. I have the bony part right there. I'm going to go 1 centimeter above, right there, and make my X. Perfect, that's where we're going to be measuring from. Again, we're going to get a good pinch there. And measuring that at 25 again. Pretty consistent. The last one we're going to do is the thigh. So again, we want to make sure we get that true midpoint. So we're going to measure from the crease at the hip down to her patella and see that midpoint. And I get 50, so we're going to go to 25, which is right there. Again, holding my finger. Oh, I left my pen on the table. And we're going to ask her to lift her shorts. Perfect. And make that X right in the middle of the thigh. It's important to note here for differing genders, making sure you are at a safe diagonal, not right in front, a compromising position. Again, I'm going to get a good pinch. Ask her to flex her thigh. Perfect. And I get it at 34. And that's how you do skin fold measurements for a female with 3 sites. Thanks.
Go.
Alright, so we already did our skin fold measurements once. We are going to go through again just to make sure there's consistency. If there's a difference of more than 1 to 2 millimeters, we'll go through a third time to make sure, again, there's the consistency. One thing to note is that you don't want to do the same spot back to back, so you don't want to do triceps, because you do want to give them the skin time to relax and get back to its normal. So we already did all 3, we waited a second, and then we're going to go back and do them all in the same order again. So we're going to start with the triceps. And I still have that X marks this spot, so we're going to do a pinch. Go ahead and flex that arm for me. Perfect. And we are at 26. Perfect. Relax. We're then going to go to the suprailiac. Same X spot there. Getting our pinch. Oh, goodness. Hold on. And we are at 26 again. And the last one we have is the thigh. Same X there. Go ahead and relax for me. Perfect. And flex. Perfect. And we are at 34 there. All right, that's pretty consistent to what we had the first time, so we know we're pretty accurate. And that's it. Thanks.
3, go.
Alright, today we're going to be testing the YMC sit and reach test. I'm Kristen. A few things before we actually get her started. Notes on setup. You do need a yardstick, and we put it on the floor, and we taped it at the 15-inch mark. Her heels are going to be right on that 15-inch mark, straddling both sides, about hip width apart. With this test, it is important that you make sure the patient is properly warmed up and stretched beforehand, so there's no risk for injury. when she tests, a few notes to make sure that she's not cheating or doing anything wrong. You want to make sure those knees stay nice and flat, no bending in the knees. When you do it, your hands need to be one right on top of the other, no one reaching further, and you want to make sure it's in one fluid motion. So I'm going to ask her to stretch and hold it there for 2 seconds, just making sure it's not a ballistic, like pushing to get a little bit further. So she's been properly warmed up. I'm going to instruct her to take a deep breath in and stretch out on the exhale with those hands overlapped, making sure they are touching that yardstick. So whenever you're ready, touching, good, and relax. And I got 11.5 on that one. So that's pretty good. If she wants to try again, she can. She's good. All right, 11.5, perfect. That's it.
Go.
Hi, I'm Kristen. The last thing we're going to be doing with our subject today is testing her range of motion with our goniometer. A few things to note about this is we do have our axis or the focal point, which is where we're going to center that movement joint on. We have our stationary and our movable arm. The stationary arm obviously stays still, and the movable is the one that moves with that joint. Today we're going to be measuring our shoulder, elbow, hip, and knee ranges of motion for both sides of her body. So we're going to start off with her left shoulder today. The axis is going to be right over that acromion. The stationary is going to be in line with her torso, and the movable is going to go along the shaft of the humerus, so along that arm. So I'm going to first find that acromion, make sure it's in line. Go ahead and flex that shoulder. Perfect. And I have 152 right there. I'm going to then move to the other side and measure her other shoulder. Same thing, find that spot. All right, go ahead and flex. Good, and we have 165 on this side. We're then going to have her lay on the table so that we can measure her elbow. All right, for the elbow, the axis is going to be over the lateral epicondyle. The stationary is going to be in line with the humerus, and the movable is going to be in line with the radius. So finding that bony point, and then measuring. Go ahead and flex that elbow. Good. And we get 139 degrees there. We're then going to move to her hip, where our axis is going to be over the greater trochanter. A trick to finding that is internally and externally rotating her leg, which, go ahead and do that, perfect, is right there, and relax. When measuring the hip, the stationary is going to be in line with the torso, and the movable is going to be in line with the femur. All right. Go ahead and bring your hips to your chest.
My hips.
Or, sorry, your knee to your chest. Good. And relax. And for that, we got 96. We're then going to measure the knee. For this, the stationary is going to be in line with the femur, pointing towards that greater trochanter, And the movable is going to be in line with the lower leg pointing towards the lateral malleolus with the axis right in the center point of the knee. For this, I'm going to have her slide her heel towards her butt as far as she can. All right, and I have 140 on that one. I'm then going to repeat everything on the other side of the body, starting with her elbow, finding that lateral epicondyle. Go ahead and bend your elbow. Good. And we get 139. And then going to the hip, finding that point. Can you go ahead and internally and externally rotate? Alright, there it is. Relax. And bring your knees to your chest. And relax. And we get 97. And last with the knee, making sure we're still lining up. Yep, go ahead and slide. Lining up with that lateral malleolus. And we get 132. And that's how you measure range of motion for shoulder, elbow, hip, and knee.